Welcome to this explainer. Today we are taking on a genuinely fascinating topic, complementary and alternative medicine. We're going to totally bypass the dense academic jargon and translate this complex world into simple, basic human understanding. We'll look at exactly what these treatments are, how they're categorized, and the profound reasons why millions of people are looking outside the conventional doctor's office for healing. It really all starts with this one fundamental question. What exactly is alternative medicine, and why are so many people turning to it? At our core, we all share this universal human desire for healing, for comfort, and for just understanding our own bodies. But the landscape of healthcare can be incredibly confusing. So let's clear that up and answer this exact question today. So here is our roadmap. We'll start off by defining what CAM actually is. Then we'll break it down into 5 major domains. Look at exactly why people choose it, examine the scientific evidence gap, and wrap it all up with some important key takeaways.
All right. Section 1. What is alternative medicine?
Okay, let's dive into this. The acronym you're going to see absolutely everywhere is CAM, Complementary and Alternative Medicine. This simply refers to medical and healthcare systems, practices, and products that aren't currently considered part of conventional Western medicine. Basically, think of it as the big umbrella term for everything outside the standard hospital or clinic playbook.
Moving right along to Section 2, the 5 major domains.
To make sense of it all, CAM is generally categorized into 5 distinct domains. We have whole medical systems, mind-body medicine, biologically based practices, manipulative and body-based methods, and energy medicine. Let's walk through these different neighborhoods one by one to see what they're all about. First up, we have whole medical systems. Think of these as the foundational, ancient healing approaches that actually arose way before conventional Western medicine was even a thing. This includes holistic systems like Ayurveda from India and traditional Chinese medicine, which features things like acupuncture. It also covers homeopathy, which uses tiny, minute doses of substances to stimulate a self-healing response, and naturopathy. Naturopathy focuses heavily on non-invasive treatments, like lifestyle counseling, herbal remedies, and exercise, to essentially help the body do its own healing. Next, we have mind-body interventions. The core belief for practitioners in this second domain is that these two systems, your mind and your body, absolutely must be in harmony for you to stay healthy. So this domain uses techniques specifically designed to strengthen that vital connection. It relies on practices like meditation, prayer, relaxation exercises, and even art therapies to physically affect bodily functions and relieve symptoms. The third domain is biologically based practices. These are treatments utilizing ingredients found directly in nature. We're talking herbal remedies like ginseng, ginkgo, and echinacea, alongside dietary supplements like selenium and glucosamine sulfate. If you've ever felt completely overwhelmed staring at that massive supplement aisle at your local grocery store, well, you were looking right at this domain. These are the natural remedies you typically see taken as teas, oils, syrups, powders, or capsules. Moving over to the fourth domain, we find manipulative and body-based methods. Translating this into simple, everyday terms, this is all about physical movement and actual physical adjustments to the human frame. It covers exactly what it sounds like: chiropractic or osteopathic manipulation, massage therapy, reflexology, and structured movement practices like Tai Chi and yoga. And our fifth domain is energy medicine, which is based on the belief that an invisible energy flows through the body. And this brilliantly illustrates a key distinction because it breaks down into 2 very different types. First, you have biofield therapies like Qigong, Reiki, or therapeutic touch. This is where practitioners apply pressure or place their hands in or through purported invisible energy fields around the body to restore balance. Contrast that with bioelectromagnetic therapies, which involve the unconventional use of physical, measurable fields like magnetic, pulsed, or alternating current fields. Which brings us to Section 3, why people choose CAM. Now let's talk about the deeply human element here. The first major driver is simply finding relief. Often, conventional medicine can fall a bit short when dealing with certain chronic illnesses, and a huge majority of people turn to CAM, especially during really serious events like cancer treatment, just to manage those long-term challenges. Beyond that, patients consistently report that these therapies significantly boost relaxation, calm their emotions, and relieve the heavy anxiety and stress that inevitably comes with being sick. Furthermore, patients use these alternative methods specifically for targeted symptom reduction. There's actually increasing evidence that certain CAM therapies help control the really harsh side effects of standard medical treatments. For example, acupuncture is very often used to relieve the sickness caused by chemotherapy drugs, to soothe sore mouths caused by head and neck cancer treatments, or even to manage pain after surgery to remove lymph nodes.
Now, what's really interesting about this is the psychological benefit. You decide which therapy to use and how often you use it. CAM empowers patients to take a highly active, controlling role in their own recovery. Instead of just passively receiving a treatment, they feel like they're in a real partnership with their therapist, which helps them reclaim control over their emotions and their overall health journey.
Then, of course, there's the profound impact of the human touch. Lots of patients simply like the idea that these therapies seem non-toxic and natural. But beyond the actual substances themselves, patients report getting a massive amount of emotional comfort and satisfaction from the physical touch, the supportive talk, and the dedicated time that a complementary therapist usually offers them. That focused, unhurried attention, that is a very powerful draw.
Section 4. The scientific evidence gap.
So why is there an evidence gap with some of these therapies? Well, it really comes down to a few core challenges. First, carefully controlled medical studies using human subjects are highly expensive and incredibly difficult to run. Second, conventional drug trials are largely funded by pharmaceutical companies that develop and sell those specific drugs, which is a financial model that just doesn't easily translate to naturally occurring herbs or ancient therapies. And third, a lot of alternative therapies are simply difficult to demonstrate in traditional animal studies. So, these logistical and financial hurdles heavily impact the research landscape.
Finally, Section 5. Important key takeaways.
If you only take away a few things from this explainer today, let it be these 4 memorable points. First, CAM is categorized into 5 distinct domains of practice: whole systems, mind-body, biologically based, manipulative, and energy medicine. Second, the core focus across all of these is usually on mind-body harmony and utilizing natural, non-invasive remedies. Third, that deeply human element. People seek CAM for a sense of control, dedicated emotional comfort, and targeted symptom relief, especially with chronic illness. And finally, scientific evidence gaps absolutely do exist, but they're largely driven by the high costs of human trials and the current structures of research funding.
So, we'll leave you with this provocative final thought. As conventional and alternative therapies continue to intersect in our modern world, how will personalized healthcare evolve to give patients both the rigorous scientific evidence and the deep emotional comfort they so clearly desire? It's really the core tension of modern healing, and it leaves us with so much more to explore. Thank you so much for joining me for this explainer, and keep asking those big questions.